In this video, we're going to look at some issues surrounding health literacy and at some practical tools and techniques. When we say health literacy, we mean how much someone can understand, process, and communicate health information. Health literacy isn't just about whether someone can read and write. It's about having good reading, listening, analytical, and decision-making skills. For our patients to make informed decisions, they need to be able to understand and weigh up everything we tell them. We know that a large number of UK adults struggle with health information. Here in Shropshire, it's estimated that around 38% of 16 to 65-year-olds have a low level of health literacy. Therefore, we don't really know whether our patients and visitors are fully understanding what they're being told. Sometimes it's clear that someone's struggling, but sometimes we might not realise. These are some warning signs that someone might not have a high level of health literacy. Low health literacy is often more prevalent amongst these groups too. There can be a lot of negative implications, both for individuals, their loved ones, and for the health service in general. Here are some real-life examples of what can happen when someone has a low level of health literacy. When we've studied healthcare or worked with medical language day to day, it can be easy to forget that others aren't as familiar with it. We have to remember to pass information on at a more basic level. Even with the same instructions, results can vary widely. We often understand and interpret messages differently. So what can we do to try and make sure that health information is well delivered, processed, and understood? Firstly, don't just ask if someone understands. Ask them to explain back to you or show you what they think has been discussed. Try not to present long lists of facts or instructions. Break your conversation or information down into manageable chunks, and remember to give opportunity to ask questions. Use illustration if you can. Draw or find a picture that helps convey your message. Offer help with paperwork where you can, and signpost to other forms of support. Try to pitch your language at a level a 9-year-old could understand. Use simple language and keep your sentences short. Avoid jargon or acronyms wherever possible. Try to produce written information alongside the people it's intended for. You could test what you've written with a sample group or with someone who knows your audience. The easier something is to read, the more likely someone is to read and understand it. Try using lists or bullet points and leave plenty of white space on your page. Align your text to the left and make sure any images are relevant and clear. Never break up text with an image. Use a clear font and avoid italics, capitals, and underlining. Use bold if you want to emphasize something. There are a few tools you can use to test the readability of your work. You can copy and paste your text in, and the tools will suggest changes and improvements. If you use PowerPoint or Word, you can use the Review tab to check the readability and accessibility of your work. If you'd like to find out more about health literacy, there are a number of useful books and journal articles you can access via the library. There are lots of toolkits and sources of further information online. Visit this URL for some suggestions. Please also feel free to contact the library team if you'd like any more information on this topic.